Recording in progress.
Okay. Hi, David.
Hi, Mark.
We're on the early side, yeah. Hopefully, come on in. Waiting for a few to show up here, so we'll be starting in a few minutes.
Hi, how are you?
Good, how are you?
Good, thank you.
Okay, this one.
I'm
So-
Mary, I'm Tam.
Tam, nice to meet you.
Oh, sorry, it's probably the bottom.
Okay.
Not to get this weather out. This morning I was like hot, and now I'm like really cold. Like, wait a minute.
Now come on, behave.
Right. Yes, I will.
You got lots of stuff.
I know, I didn't realize it was like this. Maybe. Look at all that good stuff. No, we're not gonna go into it. I'll tell you when I see it. Oh, there it is. No. Oh, there it is. 3 from the bottom. The one that says CASA. PDF.
Okay, you're seeing what I'm in.
Yep. That's okay. It's right that one.
Oh, okay.
Oh,
there it
yeah,
is.
sorry.
That's
You don't
SMK.
even know what you're looking for, right?
Okay, yeah. Yes, I saw the SMHK
Go.
and the PDF.
Yeah, that's the one.
No. All the applications close it.
Right. Yeah, that's not. That's all I can do.
Close that one down. Okay. There's Rachel and Mary. A few more minutes.
Hi, Mark.
Okay.
I was telling him I scheduled this and another meeting months ago, and then yesterday, I live in St. Louis, and just yesterday I realized I have a meeting in Jefferson City today from 1 to 3, and then I gotta be here at 6. For some reason, like, I live in St. Louis, I'm like, Cape's an hour and a half, like, no big deal, like, for some reason, they just didn't. Oh, and so I texted somebody,
Something kind of at least closer.
yeah, well, no, it's Jeff City.
Oh.
Yeah. So I left my other meeting early because I was like, oh, well, was thinking like at all. I have no idea.
Traffic or anything?
No, it wasn't bad. No, and the rain didn't start until I actually pulled in on it first.
Oh, perfect.
Yeah, so it's all good. But man, it does feel good to speak. I tried Jeff City today and then here. Too much sitting. I can't be good for it.
Because when you travel overseas and you're seeing everything you walk.
Yeah, exactly. I've never actually been overseas except Mexico. But we're going on a Norwegian Mediterranean cruise and flying to Barcelona. It's my first time flying overseas for real. Mexico. You don't really fly over anything.
Yeah.
Not really.
Yeah, there's not really anything you can fly over there.
Stretching. You want me to sit there so I can be on?
Yeah, I'll swap spots in there in a second.
Not real good.
Do you need water or anything?
Oh, I'm okay. Thank you.
Okay.
It's cooking dinner. And I think they just danced. Did you see that?
Huh?
David was cooking and dancing.
Oh.
I saw you. Oh no, he disappeared on us.
Show in a minute.
How do you get your stickers to stick?
They're like not silicone. They're like specifically like the thicker ones.
Oh.
They're not just like regular stickers.
Yeah.
None of them have ever fallen off. I've almost lost my water bottle so many times, and I'm like, my heart like breaks.
Right?
Like, so much travels on there.
Is that what you do? You travel and then you pick the sticker for it?
Yeah.
Neat.
Yeah. So they're all like,
Well, where'd you go?
so Sleeping Dunes is almost like the top of Lake Michigan.
Yeah.
Michigan side. It is like a big bluff of sand dunes that looks over the lake, but it looks like an ocean. So
Wow.
it's just like
Yeah.
beautiful. They actually have a sign hanging up there that says climb down at your own risk, because it's cost $3,000 to have a life flight out of there if you can't get back up.
Oh wow. Wow.
So only well-able bodies should go down there.
Did you go?
Well, and my little kids with me, so
Okay.
like we're not going back.
Yeah.
Colorado, we go there skiing all the time. Flat River Campground is where we camped while we were at Sleeping Dunes. Solitude, we skied there last year, and I tore my ACL. This is a surf shop in Australia, where Michigan is.
Okay. Well, we're gonna go ahead and start.
Well, you're gonna figure that out. Yeah.
Okay, so we're going to start. It's 5 after. We are recording this, so I know a few of the volunteers enjoy watching the recording anyway to begin with, so they can watch it at their leisure. So this evening we have Mary Mogg, and she is from Show Me Healthy Kids. She popped up in some of our FSTs, and it's like, it'd be nice to know who she is so we know what we're dealing with. So I'm going to let her take my spot, and she does have a little sheet to show and all that, so I'll just turn it over to Mary.
Yeah, thanks. Appreciate it. Now let me share my screen so you can see the presentation. All right, can you all see online? Can you see the presentation? Yes?
Mine hasn't come up yet. No, it came up. There you go.
Okay, good. Good, good. Thank you. I appreciate it.
Yes.
Yeah, I'll see
Yes.
it. There. Ow.
Because we can just this later
Yeah.
on the camera. There we go.
Hi, everybody.
Okay.
There. That's great. We have a couple people in the room too, so I just like to stand. It makes, I don't know, I like it better. So thank you for having me. Like he said, my name is Mary Mogg, and I am with Show Me Healthy Kids. I am a trainer there, which means that I go out in the community and I present this material and different material, but mostly this. And the reason I do that is, well, let me start at the beginning. I spent 15 years at Children's Division, where I did a lot of the different jobs there. I was the independent living specialist, older youth specialist, worked in abuse and neglect investigations, did case management, that sort of stuff for about 15 years. And then I went to Missouri Alliance for Children and Families, where I trained the FCCMs, the foster care case managers. Loved that job. Did that for about 8 years, I guess. And then almost 2 years ago, about a year and a half, this job came up. And it is essentially, like I said, going around to community partners, to Children's Division, to CASA, to DJOs, and telling them all about everything that Show Me Healthy Kids has to offer, which really touched me because I adopted 3 kids from foster care. They were 2, 4, and 6 when I got them, and now I'm going to get this because one just turned. They are 20, 23, and 25 years old, right? And they are truly kids with trauma behaviors. And when I got them when they were little, even though I worked at Children's Division and I had ins everywhere, I still couldn't get them what they needed. I still couldn't figure the system out when it came to insurance, right? Because as an adoptive parent back then, you had Medicaid for this, and then later on it switched to managed care. But if you moved places, you lost different services in different places, and with adoption subsidy was different. So when I heard about this and everything came up, I'm like, I can do this job, right? It's an opportunity to train foster parents and everybody about everything that's out there so their kids can get what they need. So in the past, when a kid came into care, they got Medicaid automatically, and then they got a managed care plan. And the case managers would pick that, or the resource providers, whoever they're living with, their placement would pick that. But if that child, let's say, lived here, they would have one managed care plan. But if they moved across the state to Springfield, Missouri, they would have to switch managed care plans, which means all their health records are with one managed care plan that doesn't share with the other health plan very well, right? They don't play well together. They're competitors. So the state decided this isn't working. This is crazy. Why doesn't everybody just go under one health plan? They said, and so they did that. But they created the health plan. They said, okay, you want this health plan, then you're going to do this, 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 and this for all of our kids. Because they know what their kids need best, right? They know that. So they created this, and then there was a bidding process, and Home State Health, or Centene, got the contract in St. Louis. So that's where we came from. We started July 22 of last year. So, and you guys feel free to ask questions throughout. Probably go up there. Okay. There we go. Ask questions throughout if you want, or you can make laughter. It doesn't matter. So the way it works is every kid who comes into care automatically gets Show Me Healthy Kids. Every kid in DYS custody automatically gets Show Me Healthy Kids. Any kid who has been adopted or got legal guardianship subsidy through the state and has not yet turned 18, they automatically switched over to Show Me Healthy Kids. And then any youth who left care 30 days before their 18th birthday or any time thereafter, they still get Show Me Healthy Kids until the age of 26, right? That's a benefit that kids forget, right? I worked with older youth forever, and I would tell them everything they got along the way, and yet when they left care, everything falls out of their brain, right? Like normal 18-year-olds, 19-year-olds. So if you're working with older kids, please have them check. They probably still have insurance through us to the age of 26, which is amazing. Because children's vision, no matter what, if the kid's in care, they're going to drop off at 21 forward. Chafee aftercare is going to drop off at 23 no matter what. But we can stay involved until the age of 26. So they have that continuous care. Now, we're not going to do case management like Chafee or like children's vision, but we can certainly help them with resources and things like that along the way. Now, there's a small group that did not change over and that doesn't come to us. And those are kids who maybe have like disability, they're on Social Security disability, or they have DMH involved. For example, I was with a group of children's vision people today, and one of the kids that didn't switch over has hemophilia, maybe something like that. But his medication, his shot every month costs $12,000 every month. Kids who have that high of a health need didn't switch over to health, right?
So
I got
a question. This is Kawanda. I have a foster kid, and I'm trying to get him switched back because he's got switched to Show Me Healthy Kids, and I'm having trouble switching him back because he has cerebral palsy and he got disability. He gets a disability check and all of that, and I can't get him switched back. So how do you go back to where they were?
I don't know, because nobody ever wants to go back. So
I mean, only reason why is because he takes therapy, and in his therapy sessions, they have to keep evaluating him with this Show Me Healthy Kids versus what he already had before. And when they keep evaluating him, they keep kicking it out. It's like a long process. And that's the only thing I don't like about this. Other than that, it's really great. But it's just they keep kicking him out of services because they keep saying that they have to keep reevaluating him. And if he doesn't meet his goals, they put on there, but then I guess whoever review it says he meets his goals, so they kicks it out. It's crazy.
Yeah. So I don't know about that situation, but at the end of this, when you see, you'll have my name and information come up. If you email me him in the morning, or email me about him tonight or tomorrow morning with the name, the date of birth, and DC, look into that. Yeah.
Okay.
And that's I'm happy to answer specific questions and look those up tomorrow. And then I have like a whole team of people who can help me answer some questions too. I'm a little slow sometimes because I'm not the expert on it, but we'll figure it out together.
Okay,
yeah,
thank you.
It may be or it may be something completely complex. I find things all over the place lately. And it's because we're new. Like, I hate to say it, July 2022, but we're new. And still figuring out all those things. Sometimes a kid never switched over, and they should have switched over to Show Me Healthy Kids because they're perfectly healthy, but there was like a glitch in the system, just one magical thing. They never switched over, and it's been a year and a half. So we don't know about that unless somebody brings it to our attention. So let me know, and we'll do a little looking into that. But yeah, some of those kids didn't switch over because their care just costs too much. And Show Me Healthy Kids, there's probably something that says we don't take kids whose shots or medications cost $12,000, right? And there's not a lot we can do about that. Now, when I like to show this slide to everybody, even if you're not the case manager, because you guys might get questions and people wondering about why certain things aren't covered. So this on the left side, that's the Show Me Healthy Kids card. That's what our insurance card looks like. When the state gave us the contract, they said you're going to take on medical health services, so physical health, behavioral health, vision and dental, and then case management and coordination services when it comes to all of that. What they kept under Mo Health Net, fee for service, Medicaid, whatever you want to call it, what they kept on that other side was pharmacy. So what that means is if a foster parent goes to the pharmacy to get medication for a kid and they hand them the Show Me Healthy Kids card, that pharmacy is going to say, we don't take that because they don't. For prescriptions, they take Mo Health Net, right? The state kept that within. It means it's covered, just not under us. The same thing with ABA services. Those are usually for kids who are on the autism spectrum. Those are covered just through the states. So they have kind of both insurances, right? They have us for one specific category. That other stuff is covered by Mo Health. Same thing with C-STAR services, which is substance abuse programs, and DMH services. And then I don't think you can see it under there is transplant services. So they're getting a transplant. They have us for care management stuff, but all that cost for a transplant goes through Children's Vision, through Mo Health Net, through Medicaid, fee for service, whatever you want to call it on that side. Does that make sense? Now, what I always tell people is if a foster parent asks you or they're worried because somebody's not covered, don't let them pay for the medication. Children's Division, well, we can't reimburse for medication. Children's Division has a hard time reimbursing people for medication. Wait till the next day, right? We can help, like we can tell a pharmacy, hey, it's not us, it's Mo Health Net. Their Mo Health Net ID number and their Show Me Healthy Kids number, it's the same. It's the DCN on both. So a good pharmacist, you tell them they have Mo Health Net, run the DCN, they'll do that. But it doesn't happen all the time. So give us a call the next day, give the Children's Division a call the next day. Don't pay for it out of pocket. It's too hard to reimburse for that kind of stuff, unless it's absolutely emergency that night. So this is us in the center, right? We want to be the center, we want to be the ringleader in the circus when it comes to all of this stuff. We don't do medication. We don't cover pharmacy or prescription, but we have a pharmacy director who's happy to talk to any about medication the kids are on, right? Kids are on, a whole lot of different medications along the way. And if you are concerned or a caseworker is concerned, like, why is this kid on these 3 medications? According to what I know, they don't mix and match or not. Give us a call, talk to our pharmacy director. They can walk through those things. They can walk through why a kid's on a certain medication. They can tell you the questions to ask, right? Like we were staffing a case the other day of a child who was on a medication for PTSD, but it was generally for night terrors and flashbacks. And this kid wasn't having that. So the pharmacy director, they told the caseworker, like, hey, ask these questions about this, kind of just get a little clarification on that. So we're happy to help with that. We follow the kid. So we attach to the kid. Every child has somebody who's Show Me Healthy Kids attached to them. The caseworker, somebody should know that person's name. If they don't, it's easy to figure out. But we follow the kid. And the reason is because if the kid lives here and then they disrupt their placement and they have someone else, then that same person is going to stay with them unless their health needs change significantly. And the beauty of that is right now we have a 1.5 years worth of records or anything else we were able to collect before. But in 5 years, we're going to have this child's entire health history from when they came into care until then, right? Which is absolutely amazing. We're going to have that available for anybody on the team or, as part of the child's case who needs that. We're also going to be able to help them get resources and services and hopefully have that continuity of care, right? Somebody's going to be able to look and say, look, this kid had asthma 3 years ago. Now they're telling you they have this, like they haven't had an inhaler in 6 years. What's going on with that? Or they can look and, tell somebody they have 3 medicines that were sent to the pharmacy. Only 2 were picked up. Why? Like, what's going on with that? Most of the times, foster parents may not know. Maybe it's at a different pharmacy. Maybe that child switched homes. Maybe they don't know. So those are things that we can kind of look at in the health system, all the systems we have access to, and help figure out. Make sense?
Yes. Yes.
All right. So when we first got the contract, we divided the state into these cool map you see with all these different colors. These we'll call our pods, right? And every pod has people in it who are part of Show Me Healthy Kids. The beauty of this is Centene is our mothership. mothership, right? And they're based in St. Louis. They're all over the country. But instead of just picking the people from St. Louis like they usually do, they said, let's pick people who live where our kids are, right? So the people who are working with kids in Cape Girardeau, a lot of them are from the surrounding area. They know what's happening in your community, right? So they can really get involved in that way. So we tried that for a while, which was great. And then we decided we got to get a little more specific because all of our people can't know everything about every population, right? They can't be experts when it comes to ADHD and oppositional defiant and cerebral palsy and the NICU, right? So they said, okay, we're going to keep our pods across the state, but we're going to set people up so they have an expertise, right? So we have our adult behavioral health and physical health population. When adult is said in the medical insurance world, that means 16 and up, right? So these people are experts when it comes to that, right? What's behavioral health issues for kids 16 up? Those kids who have those significant issues, they're going to go to those people. Pediatric physical health and behavioral health. That in the insurance world is like, I think, age 3 to 16, right? So they'll specialize in that. We have our Start Smart for Baby and our NICU, which takes like the 0 to 3. And so those people are experts when it comes to kids coming out of the hospital, when it comes to safe sleep, when it comes to first steps, nurses for newborns, that sort of stuff. That's where they're going to focus. And then we have our DYS and adoption subsidies specialists. They're those expertise. That's a beast among itself, right? Because DYS is confusing. They have custody, so the parents, it's a weird world when it comes to where we fall in. Adoption subsidies is interesting too. So we have the people who are going to focus on that and become experts in that area. And then foster care new and foster care primary. This is foster care new is for kids first coming in care. They all kind of like fall into that until we figure out what's going on health-wise. Unless they came into care and right now they're in the hospital because, they're having brain surgery. Well, I think we might know where that kid goes, right? So they'll automatically go there. But the rest, we're kind of figuring it out and looking at the records and that sort of thing. And then foster care primary, that's where the child's primary issue is being in foster care, which is a big issue, right? I mean, that's a huge thing. We know that. But they don't have maybe behavioral health stuff going on or physical health, big stuff like that going on. They're just in foster care. And I don't mean to say just in foster care, but when it comes to other stuff that could be happening in their lives, that's their big thing, is they're in foster care. So we have people attached to every kid. Now I'm going to talk a lot about your Show Me Healthy Kids person. That's one of these people, okay? Your child will have a care manager, care coordinator, program specialist, program coordinator attached to them, depending on their level of need. So care managers, they take the complex kids. These people they're clinical. They are RNs, right? So a child with cerebral palsy or a child with a feeding tube, they're going to have an RN attached to them. A child who has significant behavioral issues, and I don't mean, Johnny who's got ADHD, I'm talking foster care significant behavioral issues, right? Those really big things. They're going to have an LPC or an LCSW attached to their case. And then the rest of them kind of go in care coordination, depending on how much they need, or maybe a program coordinator. But every child has. Now, we have certain things that we have to do. If an adoptive parent says, you know what, we're good. Thanks for the insurance, 5 stars, great job on the insurance, leave us alone, we're good. That's fine, we will. But we still have to make contact with them once a year, like check up on, hey, we got new benefits, you need anything, right? Nobody likes an insurance company calls them. You will after this, but your foster parents will after this. Or in foster care, if that foster parent's like, you know what, we're good. Johnny's doing great. Leave us alone, right? That's fine, but we still have to contact them every quarter according to our contract, just to make sure everything's going the way it's supposed to. Foster care liaisons, they're the ones who are first going to reach out when that child comes in care and say, hey, look, we need to do a health risk assessment on this child. We need to figure out where they're at when the last time a dentist is. What's going on with them? What kind of assistance do you need? They can also give that information too. So when they're calling that foster parent for the first time, the foster parent's like, I don't know the last time I was a dentist. I just got this kid. We could probably, depending on who their insurance company was, look them up and see the last time they went to the dentist, right? Because it's all based on their claims. And so we can give that information to the foster parent. We have a lot of foster parents, mostly relative placements, kinship placements, grandma and grandpas, who are a little bit worried about giving us information. They shouldn't be. We are a covered entity when it comes to HIPAA. We have to verify HIPAA when we call somebody. So we call grandma and grandpa, and they're like, we're not going to give this kid's social security number, this kid's date of birth. We're not doing any of that. Like, we know better, right? And we're like, okay, call your children's vision worker or call your worker, tell them, ask them who we are, or we'll send them a letter saying, hey, we are covered people. This is how, give us a call back then. So some of them are really worried about that. So we want to make sure that they know who we are. They're going to get used to the foster care liaison calling when somebody new enters their home. But they're going to let them know everything that's going on, everything they can qualify for. The other people that are a little different on here are our community health services representatives. These people are those who are going to get a hold of those hard to reach people. They haven't been out in the community much, but they're starting to go again now that kind of COVID's wrapping up for the most part. They're going to go out in the community and reach that 22-year-old who's been in the hospital 3 times since they left care. They know they have insurance, but we can't get a hold of them. They're talking about ways to avoid going to the hospital or the urgent care for the 5th time this week, right? So they're going to be the ones who might be going out to their house and saying, hey, let's talk about this. Or the ones who they can't get a hold of grandma. Grandma's like, I don't want to talk to you. I don't want you to come to my house. Leave us alone. But hey, grandma, though, like you have these benefits and this sort of stuff. They might go to the house or meet her at McDonald's or kind of discuss that sort of thing. And then we have our transition coordinators. Their job is, they're like an entire unit among themselves. Their job is to work with youth and families and caseworkers when youth are transitioning in and out of residential, in and out of treatment foster care, in and out of hospitalizations and things like that. So they're going to attach the case along with somebody else from Show Me Healthy Kids. So sometimes you might be like, why are there 2 people from Show Me Healthy Kids on? That's why. Because we have the one who's working towards the transitions, like this is what's needed for a kid to go to residential or leave residential, or how do we make sure this kid's successful when they leave residential, like when they go to a home, right? They're going back to grandma. What's changed? So we want to make sure like the services are in there and everything's kind of a smooth transition for them. I always think too, like when a child's discharged from the hospital, the person who picks them up at discharge may not be the person they're living with, right? Maybe the caseworker. Where they go may not be the place they're staying tomorrow. So our transition coordinators are going to call and be like, this kid just got released from the hospital. Do you have the discharge somewhere? Because who knows who has that? You know, there's a follow-up appointment next Tuesday. Is that an okay time for you? Are you okay to make it? Do you need assistance with that? Do you need to change that? Like, what's going on with that? Because we know that kind of stuff, following up with that is going to avoid them going back into the hospital again. And that's what we want to do. So your Show Me Healthy Kids person will be one of those people. That's why I say your Show Me Healthy Kids person. And then if you email me, I'll be like, their program specialist, their coordinator is this person. But that's how we do that. And then we kind of divide kids up into different tiers. Who needs what? Wellness and prevention. That's that adoption person who's like, you know, I don't call us, we're good. Johnny's good. He gets his shots every year. We're excellent. Thanks. They're tier 1, right? We don't have to work a lot with them. We call them once a year. But everybody else will go on the triangle depending on their need. They can move up and down that. Now, we have to outreach within 14 days of a child coming into care. We have to do our assessment, our health risk assessment, 14 days from coming into care. That means the child comes into care and we don't get notified till 3-ish days later. That gives us 11 days. And at that point, we look in FACES, the Children's Vision System, and see where that child's placed, and we call their placement provider. And then if they don't answer, we send them a letter. And then we call them again the next day. And then if they don't answer, then we call the caseworker. And then we call the caseworker. And then we call the foster. And we call the caseworker, right? Because we have to get a hold of them. I had one kinship. I was doing a presentation for foster parents, and no, it was a caseworker. She said, my kinship parent said, you guys have called like 42 times. Okay, we don't want to do that, right? We don't want to create a rage. We don't want you to hate us. Tell me what's going on, right? Well, kinship placement got 6 kids, kinship, in her home at one time. We have to reach out. So we are calling. Well, can't you just put the kids like all together, right? Make it one home. Yeah, we can definitely do that, right? So I go back to my people. I talk to my people. Like, sure, we can do that. All that kind of stuff. Call the caseworker, tell them that. And then my people come back and they said, we can do that as soon as she answers the phone the first time. Until then, our system doesn't know they're together. All right, there it is, right? Tell her to answer the phone, please, and then we can do it. Then we can put them all. We're not gonna, call her back in an hour and do the same thing. We can do them all right then, but not until she answers the phone the first time. That's one of our biggest barriers, is getting people to engage. I'm doing foster parent trainings. I'm doing a foster parent appreciation dinner on Monday night down in Portageville, and doing just a spiel for like 30, 45 minutes to let them know what's available. Because once they know, they're like, this is somebody else on my team who can help, right? This is somebody else who can advocate for the kid, somebody who can help the caseworker, right? Instead of grandparents calling a caseworker to try to find a doctor, and caseworker trying, but that's a low priority for them, call us. We can help you find a dentist in the area, right? That's our job. So we have that. We are a captive audience when it comes to these kids. That's all we work with, right? We want to attend FSTs. That's the other thing. In the FSTs, we are not going to sit there and have a whole lot of opinion when it comes to the permanency plan and the concurrent plan, right? That's on the team. We get that. But we're going to be listening. And sometimes you might not hear from us at all. But if we hear, the kid's struggling in school, or, they're failing a subject, we will speak up and be like, we have tutoring services,
Or mom needs transportation to visit her child. That's a benefit that we have, right? That's when you're going to hear from us in those FSTs. In the initial ones, it might be like, hey, we don't know who this kid's dentist is. Well, let us look it up. We'll do our magic there and try and figure that out for you. That's really why we want to be invited to the FSTs. Because a lot of times we don't know what we can provide and nobody knows what that child needs until we get in there. And then we're like, wait, we can help with that, or we have a resource. One thing we don't provide is like humidifiers. So we had a foster parent who needed a humidifier. We found out on an FST. We didn't say we can buy it, we can do it. We said, let us look. We were able to find one at a foster and adoption care coalition, one of those places. They were able to get it and have it to the house. It was excellent. It worked great. Again, another thing to take off the plate of the placement provider and the city worker. Let us get in there and help to find resources. These are our community advocates. These are some of my favorite people that are part of my team. In the insurance world, we call these the social detriments of health, right? In order to be healthy, you have to have housing and food, period, right? You cannot expect somebody to be physically and mentally healthy if they don't have housing or food, or if they don't have transportation to get to their medical appointments, or they're in jail or having trouble with the law, or they don't have education or money, right? So we call those social detriments of health because they screw with somebody's health, right? They make barriers, they create barriers for them. These people are in charge of these areas to make sure barriers are removed. So when it comes to housing and food, Becca, she lives in Fredericktown? Yeah, she lives in Fredericktown. She might know about a housing or food issue happening with a kid who's getting ready to leave care. She's going to look up resources in the area. She's going to find that stuff. She's going to pass it on to that care manager. There may be a foster parent who has questions about this kid's involvement with the law. Turns out our kids can get a little bit of trouble sometimes, right? Well, Amy Meyer, juvenile justice advocate, she used to be a DJO in St. Louis City. She can answer questions, right? Things like that. Transportation is huge, and it's a benefit that we offer that you guys are going to love, but it's a little, it's not sketch right now. It's just confusing to access in certain areas. So Candy's job is specifically to focus on that. She is the go-to person when something gets messed up or somebody says, we don't do that or we can't do that. She steps in and fixes it all for us on it, right? You probably won't hear a lot from them. Actually, you guys might, because they're going to be on different boards and going in the community and doing different things. So you guys might hear from them more than like foster parents will. All right, some more benefits. The first two, partial hospitalization and intensive outpatient. First of all, my kids, they could have certainly used this when they were growing up. But Medicaid, before we got the contract, Medicaid never let kids in foster care use these two benefits. They never let them. I was like, what a great, as a caseworker, I was like, I could have seen a lot of kids doing partial hospitalization instead of going to an acute stay at a hospital for 4 days, right? Or intensive outpatient. Instead of me or a caseworker or a family not being able to handle that anymore, maybe they do intensive outpatient, right? So what that looks like, I actually have a list. Hold on, guys. Let me have this slide. Partial hospitalization can be up to like about 4 to 5 days a week. And you guys on video, don't get filthy. Look at my magical list. See? You don't get it. You do. You can have one too.
And we can scan it and send it to the volunteers.
Fine.
Yeah.
Okay, so partial hospitalization. There are agencies all over the state who do partial hospitalization. The child will go to this hospital setting where they'll get individual therapy, group therapy 5 days a week or however many days they're there. They have psychiatric appointments, they have medication management, that sort of thing. Now, we want to use these in place of going to hospital, in place of maybe going to residential or coming back from residential. A kid coming back from residential who's going to live with grandma again, maybe they need intensive outpatients along the way. So that's like 3 to 4 days a week. They go to this program, they do group therapy every day. They do some individual therapy, medication management, we meet with psychiatrists, right? It's like to help step down from higher levels of stay, or it's like a step up before they go to residential, right? Maybe foster parents just can't handle it anymore. And they just child needs to change, right? Behavior has to change. Something has to change. This may be that change they need before going to residential and completely leaving the home. It's just another support that can be used for these children.
On the picture, you've got Mercy Hospital in St. Louis. Is that they cover the Mercy Hospital here in Cape?
No.
No.
No, and that's the issue is if they don't have a program, if they have a program, we can contract with them. But if they don't have an intensive outpatient or partial hospitalization, then there's not much we can do about that. Yeah. Now I know that some of them are learning. Lakeland, for example, they use our transportation. Now the transportation benefit, I'll get more into it, but youth can't use it by themselves, right? They have to be 18 or older to go by themselves. But for example, Lakeland, for their partial hospitalization program, they use our transportation to pick up a Lakeland worker. That Lakeland worker then travels with transportation to pick up the kid, then they travel back to the hospital, right? And they do the partial hospitalization program for the day, and the same thing happens on the way home. So that's one of the benefits that they can use that way. Lakeland's the only one we know doing that right now, but I'm like, how easy is that, right? Pay somebody minimum wage to have them ride with one of our kids, like back and forth over the age of 18, do background checks, like, man, that's a great resource, right? Instead of paying cabs or everything else. Remote patient monitoring. So for hypertension, or if a child has type 1 diabetes, we do remote patient monitoring where we connect to their device, their testing device or whatnot, and we monitor that. So a kid with type 1 diabetes, we're gonna watch and see how often their blood sugar is checked, right? See if there's an issue. We may not get readings for a week. That's gonna trigger a call. Hey, what's going on? Why is this child not testing? You know, are they just not connected? Are they just not testing? What's happening there? The other thing I like about that, like testing strips, that's considered pharmacy. But for this, we'll cover it. And so if we see a child has to test 10 times a day instead of like 5, they're gonna need more testing strips. You can't go to Walgreens and just get those covered by insurance. But we're going to see, look, they're testing more than usual. Something's going on. They're going to make sure they have those supplies sent to them and they're already there for it. That's the kind of stuff we're monitoring for that. We notice that every night they have ridiculous loads, right? That can be life-threatening. That's one of the things we can talk about. What's happening there? You know, is it a food issue? Is it a medication issue? What's going on there? We can also offer private duty nursing up to 24 hours a day. Now, this is for physical health, but if a child has severe physical health issues, then the family can ask for nursing, right? And it can be up to 24 hours a day. Now, that's not a me decision, or even your Show Me Healthy Kids person on how many hours they're going to get, right? It's an individual decision. What's the child's health needs? What's the family's needs, right? Is it grandma taking care of 6 kids in her home and, you know, working full time? Or is it medical foster parent who only has that one child in her home who's, you know, trained to do that, right? Those hours may vary. And I'm not saying we wouldn't do it. We had a, they can see. I know, because I'm telling stories now. We had a medical foster home. So a woman took on a child. She became the medical foster parent for that child. She's a nurse. She was doing this. She quit her job as a nurse to take care of this kid. So when we asked her about PDN, private duty nursing, she said, no. So I'm a nurse, right? First, I'm a nurse by trade. Second, I'm a foster parent. Like, I can take care of this kid, right? I can, you know, I'm trained as a medical foster parent to take care of him. I don't need help. Well, every time we talked to her, she was, you could tell she was just getting tired, right? I mean, it's exhausting. The kids' needs were exhausting. Finally, we convinced her to get like 4 hours a day. We're like, just take a couple of hours a day, just so you can maybe be, I don't know, yourself and not a nurse for a little while. Maybe be a parent and not a nurse to this child for just a little while. Now, I will tell you, there's a nursing shortage. Since COVID, there is a nursing shortage, right? They are overworked, underpaid people, and we can't promise that we can get somebody in there 24 hours a day. We will do, if 24 hours a day is authorized, we will do our dangest to find a nurse or 2 or 3 who can get in there every day. But we are not magic. And I like to bring this up because we had a grandparent, I don't know if it was a grandparent, it was a kinship placement, whose house was a little sketch. She was maybe a little belligerent, right? She wasn't super nice. And the child had extensive needs. We had a nurse for a while. Finally, nurses just stopped showing up. She would even not let them in sometimes. They just said, no, we can't make a nurse go. They're not employed by us. We can't make them go. However, we will call places up to 10 times a week to be like, do you have a nurse yet for us? Do you have a nurse yet? Can you make this work yet, right? We will definitely work super hard on that. But we can't make them do anything. They work for whoever they work for. After school programs. So we offer a voucher for $25 a year for after school programs. So this is like Boy Scouts, Girl Scouts, that sort of thing. Boys Club, 4-H Club, for a child to register for. It's easy. It's a voucher. The agency fills it out. They send it to us. It gets paid. It's like magic. Attach is a caregiver support group. So this is a free support group for people who are taking care of kids with trauma behaviors, right? Those big behaviors. They have support groups that meet 2 times a month, I think, or 3. They're online. It's a nationwide, actually, I think it's an international group. I think they separate them though by countries. But it's a peer-led support group by people who have kids who have similar behaviors, right? And they support one another. Now, if you go to this website, because I'm going to send you this and it's all hyperlinks that are all underlined, you're going to see like it's like $130 registration fee or membership fee. For our families, it's free. So there's a different way than just don't go to the website and sign up there. There's a different way, and that information will be up here in a little bit. They generally can email or text or call and say, I want to be in this support group. My kid has shown me healthy kids, and it's taken care of at that point. Comfort to go bags. So these are generally for kids who are just coming into care, or maybe that kid who's transitioning in and out of residential, right? Who doesn't have the things. But we can do comfort to go bags, which get sent to their house. So for our little kids, it's like a backpack, and it comes with like a blanket or like a sippy cup. For older kids, it's like a duffel bag. It's a nice duffel bag that has like a blanket in it and a journal and different things like that. The eyeglasses upgrade. This is one of my favorite benefits. So if you've ever taken a child who's in foster care to the eye doctor, when they come out, they have all those beautiful frames around them, and the lady behind the counter then pulls out a box of Medicaid frames and says, choose from these, right? These are your Medicaid frames, because that's the allowance they get. Well, we've been able to add $100 onto that so they can get a pair of frames off the wall, or for maybe older kids, they can use that $100 towards contact lenses. Now, the other thing that's part of that is we cover glasses and frames once every 2 years, unless there's a major change in prescription. However, if your child loses or breaks them before 2 years, we will replace them. Okay? I have not heard of a limit. Once a month they lose or break them, we will replace them before the 2 years is up. We're not going to let your kid go without seeing. A lot of people don't recognize that. They just see, oh, once every 2 years. We're not going to let your kid go without seeing, right? Now, we may not be able to up that prescription because it's not a huge change, and that takes eye exam and different things like that. But we can definitely replace the glasses and the frames, which would have been so helpful. Like when my Joey was like, I guess 7, 8, he would literally just look at me when he's mad, and he would take off his glasses and just like tear them up in front of me. I'm like, that hurts you more than me. And he knew better. I'm like, oh, that's my money every time. That's one of the things that we can do. Other thing, tattoo removal. Now, this is for human trafficking and gang-related tattoos. We have contracts with dermatology offices, not tattoo places. They said, no, thank you. We don't want to do medical billing for you to do this, right? But dermatology offices already have medical billing. So we partner with them to do tattoo removal for gang-related or human trafficking tattoos. I love that. See, now is the point where like foster parents are like, oh, maybe I'll answer the phone.
Yeah.
Yes, answer the phone, please. Oh, sensory kits. These are probably one of our most popular items. I think we've given out probably over 800 now. But we have 4 types of sensory kits. So these are for kids who have difficulties with sensory processing. Now, for a lot of kids, that's because they're on the spectrum. But if your child has one of like 20 different diagnoses and they're having trouble processing sensory stuff, they can get one of these. So it's like autism, obviously, but it's also ADHD, oppositional defiant, PTSD, anxiety, malnutrition. I think one is like gender identity dysphoria. I mean, there's like 20 different diagnoses that are just all over the place where they can qualify for a sensory kit. So all we have to do, we just need that placement provider or caseworker to call us. Say, hey, my kid's having trouble sitting still in school. And like, how about a sensory kit? We look up, see if there's the correct diagnosis, one of the 20 diagnoses they have to have, and then we'll recommend a sensory kit. And then those get sent directly to the house. Now, there's 4 different kits, and our Show Me Healthy Kids person will work with whoever we're talking to figure out which one's best for that kid. We have the yellow one, which is the little steady sensory kit. So they all come with like Play-Doh, fidget spinners. They have like tactile stickers for those who need that constant touch. They have shoe necklaces and bracelets in there. And the little steady has like a portable wiggle seat. So it's a seat that goes on their chair, so they constantly have that sensor and they're constantly like moving around thing that they need instead of just going crazy. The little quiet and calm and the big quiet and calm. So that's for like noise issues. So those come with sound machines, and then they come with noise canceling earmuffs. Now, they are earmuffs. And the reason I say that, they're not headphones because headphones play music. These do not. They cancel out the noise. A lot of the schools are like, they can't bring this. Yeah, they can. Put that on their 504. That's ridiculous. They don't play music. They need this to concentrate. I get not during a lecture. Well, maybe. But other times, yes, they can definitely have it. And from what I understand, they're very, very good quality. noise canceling earmuffs. So not the kind, you just get at Five Below or Walmart, they're very good quality. And then we have the Snug Comfort Sensory Kit. So that will come with like a weighted lap pad, and then it has like a bodysuit, a snug bodysuit that they can kind of like get into, like be in their little cocoon where they have like that deep pressure touch that a lot of kids need. So we'll work with whoever we're talking to figure out which one they need, and then check the diagnosis, it gets sent out. We do have to let the doctor or therapist know that we're sending them out. In the past, we had to wait for like them to say it's fine. Because nobody wants to call us back. Nobody's got time to call us back and say, yeah, it's fine, you send my kid Play-Doh. Like, so now we just got to notify them that we're sending it, and it goes. Oh, no. Homer helps ADHD. I took this off our vice president's desk, so you guys don't get to touch it. Homer. Okay, Homer is our mascot. He's a hippopotamus. He's the mascot for Homestay Health. So Homer Helps ADHD is the new program, and he helps with deep pressure touch, and he warms and he cools, right? So that child that needs to hug something that has like those beads in there that needs to heat up, they'll have that, or for cooling sensations, things like that. They'll have that. It also comes with activity book. So this is for kids who are between the ages of 4 and 12 who have ADD or ADHD and are on medication. Apparently it helps with medication compliance. I don't know how, but that's how we got it through, because we gotta squeeze things through sometimes to make sure that they get, that the state says it's okay. The activity book, it's one for ages 4 to 8 and one for ages 8 to 12. And it's kind of like, hey, you're not weird. Your brain's just made different. Right? This is the kind of things your amazing brain does, right? That maybe other people say, you run around too much this and that, but your brain is actually doing this, and kind of helps them understand their ADHD and things like that. So again, caseworker, placement provider, please give us a call. We'll see the diagnosis, we'll see the medication, we can send out, right? Pix Help. This is an app that is designed for teenagers on their phone by teenagers. And what it does is it really detects, helps to detect isolation, loneliness, and depression early, right? COVID made a lot of kids lonely. And if they weren't lonely before, they are now, right? Just because of what COVID has done and how the world works nowadays. So kids can download this app if they're 13 or older. They have to have parents' permission, but they download the app and it connects them with it has like an AI thing that they talk to back and forth, which is really cool. It talks with them about like how your day was, how you can handle things, what's going on. The app has like a to-do list on it, which apparently if the kids are using the to-do list, it increases their engagement with like the tool in general, like 3 times. It has like educational stuff. So again, like the ADHD, it has videos and like documents about ADHD, like, hey, you have a diagnosis of this, here's some information on it, and in their terms, right? So they really understand that. Because that's a huge thing. When somebody has diagnosis of anxiety or bipolar, it really helps them to understand what it is and what's going on in the brain in order to help them take medication, do therapy, to know that, they're just, the diagnosis is what's doing that, right? It also has a live chat feature. So if that child is really struggling and they need to talk to somebody right there's a button they can push on there and it connects them to a live person who can help manage crises and things like that in that. It's very cool. See that little guy there? You guys can download it on your phone. But because you're adults and you're not so cool, you don't get all the cool features. It'll get on there, and the AI thing will tell you dad jokes and things like that, but you don't get to see all the cool features because you're not with Show Me Healthy Kids. HiSET. Okay. If a kid is 16 and older and has dropped out of high school, we will pay for the HiSET test, right? So the HiSET is one big test made up of 5 little ones, right? So we will pay for one HiSET per year. So if a child is dropped out of school, 16 or older, then when they're ready, they can be like, hey, I want to take the math course. So then we send a voucher to them that has like a code on that to use when they sign up for the math portion of the test. It takes care of it. When they're ready for the writing, if they're ready for all 5 at once, that's fine. We'll send all 5 vouchers codes out to them, and that way they can take it all at once. Now, they can use it once per year. So if they fail the HiSET or they fail the math portion, we'll pay for it again next session. But the tutoring can help with that. So I've been waiting forever for this benefit for kids in care, especially like having worked with them. We understand like how much they're behind educationally sometimes, and they need that extra support. And the school system all the time, those in the school system, they're dealing with so many other kids. And I think sometimes they think foster kids, like they have extra resources, like case managers can do that, this professional, this one. Well, that So then they focus on those other kids maybe who need it. So our kids were really not getting what they needed. So we have partnered with Club Z. They are a tutoring agency. Now they are all over the state. They have franchises all over the state. If there is not a franchise in the area, they will do remote virtual tutoring, or they will contract with somebody in the community to do the tutoring with you. They get 20 sessions per member per year. So somebody asked the question today, is it calendar year or is it like when they start? I'm thinking it's when they start, but I'm not sure. I'm going to find that out. But they have to be in Show Me Healthy Kids and failing or at risk of failing a subject. That's it. Right? So somebody asked me, what's the minimum age? There isn't one. I mean, they got to be like in school, right? If youth has dropped out of school and they want a tutor to help them study for the high set, they can use this. We have a foster parent who has a youth whose IQ is really low. The kid's in school, but just going to earn a certificate of attendance. She's like, I just wonder if he could pass the high set. Put a tutor in there. Use the tutor. Let her assess his skills, kind of see where you're at to see if maybe this isn't the option. Maybe it's not just a certificate of attendance. Maybe he can pass the high set if you can get that. So that's one of the things they're using it for. I hear it's going really, really well. At first it wasn't, right? Because people like you and me, we love this benefit. We're like, oh, kids need it. Well, kids didn't love it. And so everybody was signing them up, and the tutor would go to the house, and the kid would be like, screw you, I'm not doing this. Well, apparently Club Z had to pay the tutor anyway, so they call us. They're like, look, this is happening way too much. You're losing a lot of money. So like, all right. So now my plea is to you is if you sign your kid up or somebody signs the kid up, please let the kid know, and maybe be a willing participant in that. But other than that, I hear that it's going really, really well. These people are all background checked. They're all through the state. They're all 100% good to go. So we should not have any issues. Very popular benefits. I like it. All right, for our older youth, adolescent to adult. So this is for youth who are getting ready to age out of care. And we consider that, 18 and up, because who knows when they're going to age out of care. Our staff gets assigned them. So this may be where they have two people assigned them. One who's working with them on like all their health and things like that, physical health, behavioral health. And then they might have somebody on the adolescent to adult side who's going to work with them to figure out what their health needs are, like when they leave care. Hey, do you have a primary care doctor when you leave care, right? I mean, you're going from a pediatrician to a big kids doctor, right? An adult doctor. Do you know how to do that? You have one. They can also provide resources like kids getting ready to leave care. They can support them and provide resources for like housing and different things like that, right? It's not just healthcare. Although that's what they're gonna, obviously that's what they're really good at. Housing resources we can't pay for, we can't make somebody do that, but we can definitely offer resources and things like that for them. Choose Tomorrow is our zero suicide program. So we get notified, obviously, if a child has tried to kill themselves and they were hospitalized. We get notified of that. We're the insurance company, right? We gotta pay. Those kids kind of automatically get enrolled in Choose Tomorrow. What we don't get notified is that child who maybe has suicidal ideations or who has threatened and not been hospitalized. We don't know that. Those kids, somebody kind of has to call us and be like, hey, or the kid has to be like, I want to enroll in this program. And this is one, again, where they get a worker attached to them who's really going to work with them to create safety plans and be in touch with them and come up with a strategy on how to prevent them from trying to kill themselves again. It's a zero suicide model, so that is the goal, zero suicide. Love this program. It is amazing and it works well when we get people to engage, right? As you can imagine, it's not easy for kids to say, maybe who are depressed or have suicidal ideations to say, yes, enroll me in the program, right? There's a sweet spot there. Many times they don't answer the phone. So we're trying to outreach them better. We did have somebody who worked with a youth who they were on the phone with them and they said, we asked, are you thinking about killing yourself? And they said, yes. So our worker was like, what's your plan? Who do you have there? Do you have somebody there that I can talk to right now? And they all three got on the phone. They created a safety plan. Because people are honest about that. They don't want to die. They just don't know what else to do sometimes. So you really got to be direct and ask. But they're skilled in creating safety plans for that youth and finding people to get in touch with, making sure 988 is called and things like that. And then HALO is our substance misuse or substance use disorder. That's what it's called now. SUD, right? So they educate them on what's available in their areas. It's for kids, it's only 18 and older, so the adult population, in the real world adult population. But if they're currently using or at risk of using. So we have a lot of different assessments. And so they can do an assessment and find out, wow, this child is at high risk of misusing drugs, right? So then they can get enrolled in this program that's really going to follow them and give them the tools and offer them support to not use drugs or to get sober. caregiver training. We have training that we offer to caregivers on trauma, self-care, behavioral issues, things like that. It's free. I'm working with Children's Division on them creating professional development plans for their foster families, right? For the resource families. If they know that that resource family has a child in their home who identifies as, a different gender, who's trans, then maybe they can, encourage them to find a training on that year and add that to their professional development plan. Find Help is our community resource finder. This is amazing. I tell people, if you ever want to find a resource, go here, click on this link. It's so easy to use. But again, if somebody doesn't have time, call us. We will click on the link and we will do the research for people, right? And that's for things like the humidifier, or for like kids going home and they need a twin bed, right? Those are things that we can help find. That's what Find Help can do, but we can also navigate too, right? We have some caseworkers who are just too busy. Maybe grandma just doesn't have the time or the resources or know how to use it. So we can do that too. There's Mom's Meals, and those are post-hospitalization or a new nutritional diagnosis. So they call them Mom's Meals because obviously if a woman has a baby, let's say a child in care has a baby, so a CYAC kid, a child of a youth in alternative care, if they have a baby, then after the baby, we can provide, our Mom's Meals will do 30 entrees, so 30 meals in 30 days. So they'll send 15 entrees out to the home, and then they'll call and they'll be like, how was that? Did you like them at like day 15? And then, that youth can be like, I really only like the breakfast. So, just send me all breakfast. Then we'll send 15 more breakfast meals out, things like that. From what I understand, they're very good quality. They're not like banquet, TV dinners, things like that, but they're very good quality. Post-hospitalization. We had a youth who used this after she had like back surgery. She's in her own apartment. She's like, I'm having back surgery. We can assist you with this, right? You're not going to be able to cook and do different things like that for a while. Or a new nutritional diagnosis like hypertension or diabetes, type 1 diabetes. You got to start eating, lower carbs, things like that. And all these meals can be customized according to the needs. Or if they were like vegetarian or gluten-free meals, things like that. The Children's Trust Fund, that's a home visiting program for kids under the age of 3. What this is really helpful for is maybe for kids who are not in care. So, maybe we're working with mom whose kids aren't in care. If that mom has Medicaid and home state health, then we will connect them with a home visiting program who gets eyes on the child, right? They get in the home. They figure out like, okay, so it's this agency in your neighborhood. Instead of having 6 people call and try and figure out who it is it First Steps? Is it Nurses for Newborns? Is it Head Start? This one agency, the Children's Trust Fund, really kind of directs all of that. Like, we give them the information. They're like, yes, it's this agency. Here's their information. That agency then gives that family a call. Asthma waves. Any child who has asthma, we want to try to avoid asthma issues, attacks as much as possible. We have peak flow meters, spacers, mattress, and pillowcase covers that, again, a foster parent told me were really good quality. Automatic blood pressure cuff for hypertension, and then Start Smart for baby. So I don't know what the population of youth in this area, in this region looks like, who are having babies, but if that youth is in care and they're having a baby, right, we want to avoid everything we can to take that baby into care and to make sure that baby's healthy. So Start Smart for Baby works with the mom as soon as we get notified that she's pregnant, works with her on getting her prenatal care, making sure that she's getting that. We do breast pumps and belly bands and like a collapsible water bottle to make sure she stays hydrated. There's a program she can participate in called Baby and Me Tobacco Free. So she's using tobacco or nicotine, then she can participate in this, and they have like different incentives for that, like free diapers and gift cards and things like that. What I really like is they follow up postpartum, right? So after the mother has the baby, they will follow up. Normally, nobody follows up until 6 weeks afterwards, right? When they go to that doctor. But we know that postpartum is a real thing. So they're gonna talk with them weekly if they need to, or daily. I talk with them and really assess what's happening there to see if they need additional support. We also have sound machines that are available and medication locks, which I love, right? You cannot be licensed unless you have a place to hide your child or to lock up your child's psychotropic medications, right? That's one of the licensing rules of Children's Division. So if that child has psychotropic medications, and for some of these things, they have to agree to care management. What that means is they have to agree to answer the phone once a month for us, right? You want this medication on fax? You agree to answer the phone once a month? Yes. Okay, here you go. Right? That's what we ask for in return, just to make sure everything's going okay, right? Child's on psychotropic medication. Let us follow up with you. So that's kind of like in exchange for some of the things what you'll hear is, are they in care management? What that means is, has the foster parent or resource parent agreed to talk to us once a month about what's going on with this kid, right? And I will tell you, usually after they talk to us like the first time for a child who has needs, they're happy to talk to us again because we can help with that sort of thing. Transportation. Okay, so I alluded to this earlier, but see, I can't sit still. I need that portable wiggle seat. We partnered, we contracted with a place called MTM, right? And they can provide non-medical transportation. So they need 2 to 3 days notice, but they can take kinship placement grandma to the grocery store. They can take kinship and child to doctor's appointments, to the counseling, to the WIC appointment, to the pharmacy, right? They can do things like that. Now, if a child is under the age of 18, they have to have somebody over the age of 18 with them, no matter what the ride is. So we will use public transportation, but generally they use Uber, Lyft, and taxi cabs, depending on what's available in the area. And I have a lot of questions in areas like this. They're like, what do they use here? We don't have anything. I don't know, but I know that they're contracted to figure that out. They will come up with a means of transportation. That's their job. So they will use a means that they have access to. I don't know how that's CTA. What is that?
That's the transit. Yeah, the office right across the hall.
Excellent. I wonder if we use them. I wonder if MTM uses them. They probably do. Because that's their job, is to contract and provide this assistance all over the state. The other big benefit, a youth. We have a youth who's 18 years old who uses this to go to college Monday, Wednesday, and Friday, right? Goes to community college. On Friday, she calls and sets it up for Monday, Wednesday, and Friday next week. These times pick up, these times drop off, right? And then she has to do it every week because I think they have like a weekly thing you have to do it on. They can take that kid 18 over to their job, right? So 5 days a week, they can take them to their job. 7 days a week, take them to their job. People always ask, what's the limit? We haven't found it, right? When it comes to mileage, when it comes to how far away, the soft limit is 160 miles each way. But if it's over that, that just means it's got to get approved by Show Me Healthy Kids for them to say yes. That's all that means. Now, the most amazing thing about this is this transportation benefit can be used for biological parents to visit their kids. So biological parents can use this to get a ride to the foster home, to the residential, to grandma's house, to McDonald's, to the mall, to visit their kid, to the Children's Vision Office, right? And that parent is probably over the age of 18, so they don't need anybody with them. So they can call, set up transportation to visit the kid at the Children's Vision Office, and they can say, you know what, I have 3 other kids with me, right? Maybe those kids aren't in care. That's fine. They just have to have their safety seats, and they have to tell them so that they can plan for having a transportation vehicle big enough, right? Nobody else has to be with that parent, and it will take them for the visit, which I love because it's one of those things, right? Reasonable efforts to facilitate reunification. Parents can't visit their kid. Generally, we say, yeah, we get it, right? Transportation, but we have a transportation resource now. We have something you can use to visit your kid. We had a parent who used this, who lived in Kansas City, used it to visit their kid in St. Louis, and then back. We have a foster or a biological parent right now who's using this. Transportation picks up biological parent from their house, takes them to the residential where the kid is, picks up the kid from residential, takes them back to the parent's house, and then on Sunday does the same thing. It's amazing. Now, this is one of those things where bio parents, when they try to call and get that set up, it's literally going to say, because bio parent is not listed on like their authorized people, right? It has foster parents, it has the worker of that, but bio parents are not listed. Call us, right? They have a Show Me Healthy Kids worker. That bio parent or that foster parent just needs to call us. We will do a 3-way call. We will help set it up, right? Easy peasy. That's one of the things like transportation. MTM does this all across the country, but Show Me Healthy Kids is, I think, the only one in the country that has that line. We will take biological parents to and from visits. So when they're talking to, Sarah in Virginia, she doesn't know that that's in there. So if Sarah in Virginia tells you, give us a call, right? We'll take care of that. We can do those 3-way calls and make sure that goes through. Oh, I have a lot to say. You're okay. Thank you. My Health Pays. Oh, My Health Pays. We will pay youth to do what they need to do for their health. So this little orange card is a prepaid Visa card. If that foster parent has it, it has money on it. If that teenager has it, it has money on there. That can be used at Walmart. Now it can be used on air filters for the furnace. It can be used on clothing. It can be used on groceries. It can be used on Monster energy drinks, toys, everything except alcohol, tobacco, and firearms. but they can go to Walmart and they can use the money on this card. And the way it works is when a child goes for their annual dental exam, Show Me Healthy Kids, once we get the claim from the dentist that we have to pay, right? They went for their annual dental. So once we get that claim, we pay the doctor and then we put $25 on that card, right? And I thought about it, I'm like, that's a lot cheaper than paying for a root canal for a kid who doesn't take care of their teeth, right? It's a lot easier to get somebody in good health habits. So we pay for, an annual wellness exam, leg testing, prenatal appointments, chlamydia screening. There's a ton of things that we pay for when it comes to that stuff. Flu vaccines, I think it's $30 for a flu vaccine, right? And it's all just to encourage good health. And it's going to save, obviously, it's going to save the insurance company a lot of money in the long run if that health is all preventative and it's taken care of like that. Now, this is one of those things like foster parents or somebody will ask me, do not ask your Show Me Healthy Kids person to fix something wrong with this. They cannot, right? That is how to activate the card, the PIN number. If it has if it's lost or stolen or questions about it, they call them, not Show Me Healthy Kids for her, because we can't fix those issues. Training. Okay, so this is for doctors, things like that. This is also professional training that you guys can use. You get free CEs from it. We have amazing training. We have a couple coming up on like psychotropic medication, on being supportive of LGBTQIA+. These are all free trainings. They're about an hour or two long. They're all virtual. So you click on this, you go on there and sign up for the trainings. They are done by wonderful people from all over the country. And they come with free CDs. There's like a pre-test and a post-test, but it's all easy. All these different topics are there. Anybody can use them whenever you want. So hop on and see what we got. Take some. Yeah. And I always put this in. I've learned what people ask questions about, right? People are like, therapy. We can't find therapists. Nobody can find therapists, right? Because therapists have stopped accepting insurance and they just want cash back. They're tired of dealing with insurance companies. So we are doing our best as an insurance company to woo them, right? Woo them back to us. So we will do reimbursement for different types of certification methods. If they want EMDR certification, we'll reimburse up to $1,000 to get a certification. All they have to do is agree to see our kids, right? I talked to step-by-step counseling. They're in St. Louis, and they're like, we are so glad to do this because we are one of the easiest people to bill through an insurance company. So apparently we've helped with that. So if you know a therapist or anybody like that, or you've worked on before who stopped taking our kids, tell them to look into it, that it's gotten a lot better for Show Me Healthy Kids. We pay on time. We'll help them get additional certificates. We just did TFCBT training that we offered. It was like a 3-day training that usually cost a lot to get. We were offering it to providers for free. All they have to do is agree to see our kids. So really trying to work on getting those therapists again. All right, this is the goal. This email address, hsh_anchors@homestatehealth.com. This is if you're like, my kid needs an oral surgeon, right? You're at an FST and they're all telling you all the stuff that's not happening, and you're like, I can find an oral surgeon for this kid. Email this right here. They will tell you who the Show Me Healthy Kids person is. This is where you can send FST invites. If you get them, Children's Division knows and FCCMs know to invite us. They just don't always do it. So if you get an FST invite and you see we're not on there, forward it to here. We'll make sure we have somebody on that call. If you're wanting to know who your Show Me Healthy Kids person is, maybe you're in an FST and you're asking them, do you have a Show Me Healthy Kids person? Like, we don't know who it is. They just need to email right here. We will get back with them. We will CC their Show Me Healthy Kids person. We'll get the phone number, their email address, and everything on there, and tell them who it is, and then they'll reach out right away. This is a great email address if you have general questions. If you're like, Mary, you said something about a sensory kit, but I don't remember details or how to get it. These are the best people to email. You can email me. I will answer, but I'm slow because I'm not in the office a lot. These people are very fast and knowledgeable. Oh, that's not one's not for you guys. And this is just other, like I said, these are all hyperlinks. And I'm going to email this to Mark and you can send it out to them. Do you mind? Yep. But like the attached, those caregiver support trainings, they just have to email family advocacy at blah, 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 and they can get enrolled in right away. The information on My Health Pays is right there. We have a 24-hour nurse line, but we also have a 24-hour behavioral health crisis line. Give that number to foster parents, to kinship providers, right? Instead of calling the police for an emergency in the middle of the night that the child's doing, call the behavioral health crisis line, right? Let us help with that sort of thing. Let us offer resources during that time. instead of doing, blowing up the placement at the time. The information on MTM is there, provider training's all there. Our member handbook is there, which tells you about the benefit with the eyeglasses. It says there's a line in there that says we will replace lost or broken glasses, right? Anything I've said today, and if you call us or you're in an FST and somebody says, we don't do that. Everything I say is at least 95% accurate. Something may change and I may not know about it. But in general, like you get a hold of a Show Me Healthy Kids person, or they're in your FST and they're like, we don't do visits for biological parents or transportation for visits. Yes, we do. Ask to talk to their supervisor, or you can email me, and we will make sure that we get that taken care of. We have a little bit of turnover. It's not huge. Great agency to work, or great organization, company to work for, but we do have turnover, and not everybody knows everything about everything. So if I've said something tonight that somebody else tells you no, ask to speak to their supervisor, or email me, and we'll get it straightened out from there. Because it's just sometimes our people don't know. And it doesn't happen often, but the thing is we never know unless somebody tells us. Somebody told me from children's speaking. They said they were doing visits for biological parents for like 3 months in a row. And all of a sudden, like we needed help getting it set up. And we called and the Show Me How the Kids person said, we don't do that. And so they didn't have visits for like 2 months. And no, we do that. They just didn't know. Like, tell us who that was first so we can train them on that. But if somebody ever says no and you're like, that doesn't sound right, or I think you do cover that, just ask to talk to their supervisor or get connected with them. And we'll make sure that it's taken care of, or you can email me. Right? I mean, maybe they're right. Maybe something's changed and I don't know, but I generally tend to know. So. Do you guys have any questions? That was a lot, right? But now you want to know what's
As far as money wise, the state pays for all this.
Yeah. So I mean, just like every child who's in care for the past like 10 years has been under a managed care plan. So it was just 3 different ones. Now it's just one of us doing it. Yeah. So there's no additional cost or anything like that. And what I like too is we're an insurance company, but it's so different, like with this population, because a lot of our workers and people come from child welfare and DYS. So we don't usually take no. Like our people will say we don't cover that. We're like, I think we do, right? And they really want to figure out ways to support the families and kids because they get it. They really do. It's kind of nice. Yeah. Any other questions, you guys? Comments? Can I tell you my hair looks good?
I saw David unmute himself for a few seconds. But then he was what? You have a question, David?
Thing I've ever heard since I became a CASA.
Yeah, let us support you. Let us take off some of the work of everybody. We really want to be there and do that. So, and if you guys have any foster parents or any other time you want me to come and speak, or you have connections to like children's, I've been to every children's vision office in the state, except for one which I'm doing virtually Monday. But some of that was a year ago. So now you may tell children's vision, they're like, what? I didn't know that. Give them my information. I'll come down and do a presentation for them, right? I'm happy to do that for anybody who needs to know.
No, the winner of the drawing for attendance prize was David this evening. So David, you'll have an email from Sharon about your little prize.
Nice. What do I get?
Okay, nice, thank you.
I'll take it.
I'm not asking to any.
I'm good.
Okay, so we did record the program, so it'll be sent out to all the volunteers so that they can rewatch or watch it to begin with. So we have Rachel, David, and one of our new volunteers, Tam. You'll get credit for an hour and a half for the program since we're coming up on 7:30 already. So unless there's any other questions, we'll go ahead and bid you all a good evening.
Thank you.
Thanks
Thank
so
you.
much. Have
Bye,
a good
guys.
night. Bye-bye.
Thank you.
Wow, that lady. Yeah, there's Mark. Yeah.
I'm still here. I'm getting ready to end it though. There we go.
I took a lot of notes.
Awesome.
Good.